Alcohol intoxication, also known as alcohol poisoning, commonly described as drunkenness, being drunk or inebriation, is the negative behavior and physical effects caused by a recent consumption of alcohol. In addition to the toxicity of ethanol, the main psychoactive component of alcoholic beverages, other physiological symptoms may arise from the activity of acetaldehyde, a metabolite of alcohol. These effects may not arise until hours after ingestion and may contribute to the condition, colloquially known as a hangover. Symptoms of intoxication at lower doses may include mild sedation and poor coordination. At higher doses, there may be slurred speech, trouble walking, and vomiting. Extreme doses may result in a respiratory depression, coma, or death. Complications may include seizures, aspiration pneumonia, injuries including suicide, and low blood sugar. Alcohol intoxication can lead to alcohol-related crime, with perpetrators more likely to be intoxicated than victims. Alcohol intoxication typically begins after 2 or more alcoholic drinks. Risk factors include a social situation where heavy drinking is common and a person having an impulsive personality. Diagnosis is usually based on the history of events and physical examination. Verification of events by witnesses may be useful. Legally, alcohol intoxication is often defined as a blood alcohol concentration per hour, depending on an individual's metabolic rate. Management of alcohol intoxication involves supportive care. Typically, this includes putting the person in the recovery position, keeping the person warm, and making sure breathing is sufficient. Gastric lavage and activated charcoal have not been found to be useful. Repeated assessments may be required to rule out other potential causes of a person's symptoms. Acute intoxication has been documented throughout history, and alcohol remains one of the world's most widespread recreational drugs. Some religions consider alcohol intoxication to be a sin. Alcohol intoxication is the negative health effects due to the recent drinking of ethanol. When severe, it may become a medical emergency. Some effects of alcohol intoxication, such as euphoria and lowered social inhibition, are central to alcohol's desirability. Alcohol is metabolized by a normal liver at the rate of about 8 grams of pure ethanol per hour. 8 grams or 10 milliliters is 1 British standard unit. An abnormal liver with conditions such as hepatitis, cirrhosis, gallbladder disease, and cancer is likely to result in a slower rate of metabolism. Ethanol is metabolized to acetaldehyde by alcohol dehydrogenase, which is found in many tissues, including the gastric mucosa. Acetaldehyde is metabolized to acetate by acetaldehyde dehydrogenase, which is found predominantly in liver mitochondria. Acetate is used by the muscle cells to produce acetyl-CoA using the enzyme acetyl-CoA synthetase, and the acetyl-CoA is then used in the citric acid cycle. As drinking increases, people become sleepy or fall into a stupor. After a very high level of consumption, the respiratory system becomes depressed and the person will stop breathing. Comatose patients may aspirate their vomit. CNS depression and impaired motor coordination along with poor judgment increases the likelihood of accidental injury occurring. It is estimated that about 1/3 of alcohol-related deaths are due to accidents and another 14% are from intentional injury. In addition to respiratory failure and accidents caused by effects on the central nervous system, alcohol causes significant metabolic derangements. Hypoglycemia occurs due to ethanol's inhibition of gluconeogenesis, especially in children, and may cause lactic acidosis, ketoacidosis, and acute kidney injury. Metabolic acidosis is compounded by respiratory failure. Patients may also present with hypothermia. In the past, alcohol was believed to be a non-specific pharmacological agent affecting many neurotransmitter systems in the brain. However, molecular pharmacology studies have shown that alcohol has only a few primary targets. In some systems, these effects are facilitatory and in others inhibitory. Among the neurotransmitter systems with enhanced functions are GABAA, 5-HT3 receptor agonism, nicotinic acetylcholine receptors. Among those that are inhibited are NMDA, dihydropyridine-sensitive L-type Ca2+ channels and G-protein-activated inwardly rectifying K+ channels. Alcohol is also converted to a lipid metabolite phosphatidylethanol by phospholipase D2, and this metabolite is shown to bind directly to and regulate ion channels. The result of these direct effects is a wave of further indirect effects involving a variety of other neurotransmitter and neuropeptide systems, leading finally to the behavioral or symptomatic effects of alcohol intoxication. The order in which different types of alcohol are consumed does not have any effect. Many of the effects of activating GABAA receptors have the same effects as Tha.